heart can stop at any time due to many reasons, which is known as cardiac arrest. The CPR or cardiopulmonary resuscitation, which is performed immediately, can save a patient or a victim.
An effective CPR performed at the right time can increase the survival chance of the patient.
So every one of us should know how to perform CPR in the right way. Oh God, somebody is fallen down. Okay, please all of you move aside. Okay, we need to have some working space. Let's check the alertness of the patient first. Okay, are you okay? Are you okay? Are you okay? No, he's not responding. So let's check with the pulse. So this is the center line where you have the trachea, the windpipe, and then lateral to it, or the side of it, if you gently press with your 3 fingers, you're going to feel the carotid pulse. When you palpate the carotid pulse, do it only on one side, not simultaneously on both sides. It's very dangerous. So start feeling it for at least 10 seconds. When you feel pulse, that means the heart is beating. So when continuously there is no carotid pulse for 10 seconds, that means the heart is not beating and it is time to start your CPR. So in the center of the chest, we are going to do CPR. Use your heel of your dominant hand. I am a right-handed person, so I will use my right hand first on the middle of the chest and I will reinforce it with my left hand. Okay? So, and lock your elbows, never allow it to bend. Lock it like that, be it in the straight line. If you look at from the side, it's going to be in the straight line. So now we start compressions, okay? Compress with the weight of your body, like this. Okay? When you do compression, there are two things which are very important. One is the depth of compression, other one is the rate of compression. The depth has to be 2 inches or 5 centimeters. Okay, so that much down you have to go. It's not superficial, it's not going to help at all. So you need to go fully up to 5 centimeters. And the rate of compression is not very slow, it has to be 100 to 120 compressions per minute. So almost 2 compressions every second. So it has to be really fast and deep. Remember, the compressions are not the only thing which is adequate now as an emergency. We also have to give breaths for the patient because the patient is not breathing. So the AHA recommends us to do 30 compressions and give 2 breaths every time. So it forms a cycle. So we will demonstrate now how one cycle of 30 compressions and 2 breaths are given to the patient. The compressions. We go for the breathing. If you have a pocket mask, that is the best. So we keep it here. Head tilt and chin lift position. Keep the pocket mask and then blow. 2 breaths for the patient is over. When you don't have this instrument, the pocket mask, you have to give mouth to mouth breathing. Again the same position. Head lift and chin lift position. Close the nostril and then blow through the mouth. Mouth to mouth breathing, again 2 counts. Once you have finished it, you have to go back to the compressions again. Again 30 compressions, 2 breaths. That's the cycle recommended by the AHA. So you have been watching single rescuer doing the CPR procedure. Now we are going to move on to 2 rescuers going to do the CPR procedure. Here the procedure is going to be the same. The compressions are going to be given by rescuer 1 and the breaths are going to be given by rescuer 2. And rescuer 1 and 2 are going to change the role periodically. Okay, now we have Dr. Anandi joining us as rescuer 2. We are going to demonstrate 2 rescuers doing the CPR procedure. So I will start the compressions. when you give the artificial breathing, the head lift, chin lift procedure is always the best. But if you suspect some kind of cervical spine injury, then it's better to do only a jaw thrust procedure, not the head tilt and chin lift procedure. So how it is done is, you keep your thumb on the zygomatic bones and then keep your fingers behind the angle of the mandible and bring the lower jaw forwards, so that the airway will open and the breathing or the breath is going to be easier for you.
Pediatric CPR is different from an adult CPR in terms of technique. We have two techniques that are predominantly used. Technique 1 is 2 fingers at the center of the chest with a compression rate of 30 compressions and 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, followed by 2 rescue breaths. Technique 2 is going around the baby's chest, 2 thumbs at the center, compressions at the rate of 30:2. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, followed by 2 rescue breaths. AED, also known as automated external defibrillator, has 3 components: the apparatus, the lead and the adhesive pads. The first step is to switch on the AED apparatus. The second step is to plug in the lead, and the third step is to place the adhesive pads. It has 2 pads. The first pad will go just below the right clavicle bone. The second adhesive pad will go just below the nipple on the left side at the side of the chest. The third step is to switch on the analyze button. If the patient's rhythm is shockable, the AED apparatus will prompt us and the compressions have to be stopped and the patient has to be cleared of everything, and then we deliver the shock to the patient. Every 2 minutes, the AED will prompt us if the patient's rhythm is shockable or not. In between the cycle, the compressions should not be stopped. Compressions need to be continued.
To summarize, the CPR or cardiopulmonary resuscitation, it can be a life-saving measure for a lot of patients and victims. But we should always remember certain points when we do CPR. The depth of compression has to be 5 centimeters all the time, and the frequency of compression is to be remembered. It should be 100 to 120 per minute, and we have to do a proportion of 30 compressions with 2 breaths. And the importance of AEDs or automated external defibrillators has also to be remembered.
Saving lives, saving bases.